us on the programme. Mr Zahawi, as always, good to have you on. And, of course, a huge amount for us to talk about this morning. Not least, of course, than that trial that is being launched today. Just tell us a little bit about it.
Yeah, absolutely. So the Oxford trial is looking at how, as has been done in the past with hepatitis and, of course, with polio and measles, mumps and rubella for children, you can look at mixing vaccines and see the impact at 4 weeks and at 12 weeks. It's an important trial. We're supporting it through the Vaccines Task Force with £7 million. It will report probably after the summer. And of course, it will have no impact on the deployment, which I'm sure your viewers will want to hear. And so if you currently had the Pfizer-BioNTech vaccine, you will get your Pfizer-BioNTech vaccine as your second dose, the booster dose. And of course, if you had the Oxford-AstraZeneca vaccine, you'll get the Oxford-AstraZeneca vaccine. This is more longer term, keeping us ahead of the, or at least in the leadership position, I should say, in the world, in helping the whole world, because no one is safe until we're all safe. And if we understand more about how we can use vaccines together, then we should be in a much stronger position in terms of vaccinating the United Kingdom, but also the rest of the world.
And we await the results of the trial then with great interest. I wonder, though, if we can focus on one of the vaccines which is currently being deployed, the Pfizer vaccine. A number of people have got in touch because of some concerns over research that has been produced in a variety of places. It appears, in fact, we've got a number of pieces of research, some suggesting that there isn't sufficient protection given by just one dose. Another piece of research this morning suggesting that by 21 days after the first dose, you perhaps enjoyed 90% protection. Can you just provide a little bit of reassurance to those who have only had one dose of the Pfizer vaccine that there is sufficient efficacy in just that?
Absolutely. The MHRA, our regulator, one of the best regulators in the world, and of course the Joint Committee on Vaccination and Immunisation, and our chief medical officers of England, Scotland, Wales and Northern Ireland have looked at this and looked at the data. And actually, after 15 to 21 days, the single first dose of Pfizer gives very high protection. Of course, the second dose then gives you that boost and that longevity as well. And that data has been examined thoroughly by all those different the regulator, the Joint Committee, and of course the Chief Medical Officer. And their recommendation of the 12-week dosing interval is the right one, and it's what we will deliver in this vaccination deployment program, the largest vaccination deployment program in the history of the NHS.
Very quickly, if we can, just a question on the Oxford vaccine. It's being reported today that they are already tweaking the vaccine to deal with the new, perhaps worrying variants that are circulating in the UK at the moment. Can you confirm that and maybe give us an idea, just roughly, of when we might have that updated vaccine coming up to speed?
Yeah, absolutely, Neil. So it's very unlikely that the current vaccines won't be effective on the variants, whether the Kent or other variants, especially when it comes to severe illness and hospitalisation. So that is the good news, which is why we're absolutely moving as fast as we can to get to that mid-February target of protecting the top 4 cohorts. That's 15 million people in the United Kingdom. But all manufacturers, Pfizer, BioNTech, Moderna, of course, Oxford, AstraZeneca, and others are looking at how they can improve their vaccine to make sure that we are ready for any variant. There are about 4,000 variants around the world of COVID now. We are the largest genome sequencing industry. We're about 50% of the world genome sequencing industry. And we're keeping a library of all the variants so that we're ready to be able to respond, whether in the autumn or beyond, to any challenge that the virus may present and produce the next vaccine so that we can always protect the United Kingdom and, of course, offer it to the rest of the world as well.
Minister, can we be accurate as to when we might get a date for the hotel quarantine scheme being up and running? There was a suggestion we might get some form of announcement from the Health Secretary today. That appears to have gone away.
So the hotel quarantine is one part of our border policy. Of course, you know that people now are required to have pre-departure testing, otherwise they'll be turned away. They have to fill in a passenger locator form, otherwise they'll be turned away. And of course, they have to quarantine for 10 days, which is being enforced much more strictly, including fines being issued by the police and much greater police presence at ports and airports. People have to actually say why they are traveling, and travel is restricted only to essential travel. But the quarantine hotel is being operationalized, and that will play a part of this overall strategy. And the Secretary of State for Health next week will be setting out the operational elements of that policy, as other countries have done. Germany changed their border policy in January, as did Canada when these new variants were appearing. And of course, we did as well to strengthen it and make it more robust. And we continue to do so with the hotel quarantine next week.
So next week, but we understand that the necessity for it to come on as soon as possible. It's a separate system, of course, but Dido Harding, giving evidence yesterday, suggested that as many as 20,000 people who should be self-isolating under test and trace are not doing so. Given that the system at the moment is, self-isolate if you arrive here from overseas, but not in a monitored hotel. How can we be sure that there isn't a similar level of non-compliance amongst international travellers?
Well, first of all, we have restricted international travel from those countries where we're worried about the variant, whether it's Brazil or Portugal or South Africa. And we acted immediately. Grant Shapps, the Secretary of State for Transport, acted immediately on that. But if you are arriving, you have to quarantine from countries where you're allowed to come to the United Kingdom for 10 days. And we are absolutely using, passenger locator forms to know exactly where you are.
But
and
I suppose the point is, though, Minister, if the system was working, there would be no need for us to have quarantine hotels.
Well, it's an additional safeguard, and it's right because we've seen other countries actually implement it and implement it well, and we think it's the right thing to do, which is why we're adding it to the other measures that we're taking to make sure that our borders remain safe and robust as we vaccinate the nation and protect, obviously, the most vulnerable. So it's an addition to that. It's not the whole of the border policy.
Sure. Can we just have a little bit of clarity? What are the tests that the government will be applying to decide whether or not we should move out of lockdown?
So, as the Prime Minister set out yesterday at the press conference, on the 22nd of February, when Parliament returns, we'll put to Parliament our roadmap of first opening schools on the 8th of March. So if you work to the date I've just talked to you about, Neil, which is the mid-February target of vaccinating the most vulnerable top 4 cohorts in that phase 1. So phase 1 goes down to 9 cohorts, and we'll continue after mid-February to keep going as fast as we can in vaccinating all 9. Mid-February, if you add another 3 weeks to that, when the vaccine protection really does begin to kick in, you're at the first week of March. And so that's when we will begin to, first of all, open schools and then begin a gradual reopening of the economy if we continue to see good data. And it's predicated, to your question, on really high quality data of hospitalisation rates coming down. We still have 33,000 people in hospital. And of course, death still remains far too high. And it's a grim piece of data, but we have to see
it does feel, though, even from the press conference yesterday, that case numbers, as much as anything else, is going to be one of the metrics, the key metrics that we use, and you're nodding along. But there are those on your own back benches who feel that the goalposts have somewhat been moved. Originally, it was all about protecting the NHS, ensuring that was not overly burdened. Case numbers, of course, if you have COVID-19, it's certainly by no means certain that you're going to end up in hospital. It does feel that is an additional barrier to the country coming out of lockdown.
Well, we'll be able to see much greater evidence. We have 2 studies being carried out at the moment by Public Health England. One is in care home residents. It's the Vivaldi study, where we're testing every day because they're in category 1 who've been vaccinated, and one with healthcare frontline staff because they're in category 2 of the people who've been vaccinated. That's the Siren study. That will give us the evidence of both transmission. Now we're seeing really good evidence from Oxford that needs to be peer reviewed still, that transmission rates for the Oxford vaccine are reduced by 2/3. And of course, protection from serious illness and death is almost at 100% with the Oxford vaccine, very high with Pfizer AstraZeneca, for the Pfizer BioNTech vaccine as well. So
we can't yet put a figure, though, can we, on the number of people within care homes, workers, care home residents, that have actually had the first dose? We talk about visits, we talk about having been offered. Can you just give us a figure on how many people in England have actually had the vaccine in care homes?
So we've visited over 10,000 care homes, and we have offered the vaccine to all residents that are eligible. There's a very small number of residents who currently are infected with COVID. You have to wait 28 days to revisit. Our plan is that we have 4 visits to care homes. So first visit is the first dose. You return for a second visit if people have been, have to wait the 28 days to get the first dose. Then the third visit is second dose, and then a fourth visit for actually sort of trying to catch anyone who hasn't been vaccinated. We have offered it to each and every care home in the UK by last weekend. And of course, the care home workers, the people who look after the residents as well, that number is rising because they have options to go to hospital hubs and to their GPs, as well as being vaccinated in the care home. And so that has been a huge success in terms of delivery. And we continue to do the other categories. That's category 1. Then you've got to go through all the other categories. We're at 90% of over 80s, 90% of over 75s, and 50% of over 70s already vaccinated.